joining me tonight, Dr. Ashok Seth, Padma Bhushan and Chairman of Fortis Escorts Heart Institute. Well, Dr. Ashok Seth, I want to ask you, because people are now questioning that is this the finding that is dictating the gaps because, availability is problems, or is it the scientific studies? And have these scientific studies really emerged just over the last 5 days since the clamor in states have begun? Or were these scientific studies available before? Why have we waited so long? These are common questions that our viewers have been asking, normal citizens have been asking. Where do you think this is coming? Is it the cart leading the horse or the horse leading the cart?
So, Navika, let me just state firstly that I won't want to discuss around the intelligence, and those are experts, virologists, epidemiologists, vaccination experts in that committee. But let me just say that, yes, it's a bit of both, isn't it, at the end of the day? It's the right strategy clearly based on science. It's also the right strategy at the moment based on epidemiology, based on public health issues. But you're right, this data was there in February even. And at that time, I wondered why we had just gone to 6 to 8 weeks and not 12 weeks, when even WHO had suggested at that time that the vaccination period should be at 12 weeks. In fact, that was February. And England had already expressed the fact that they would do one dose so as to cover a wider population. And I still remember the NTAGI chief saying at that time that we're not convinced about the data. That strategy is meant for countries which have non-availability of vaccination. We have enough of vaccination, so we don't need to worry about that. That was actually the statement.
Dr. Seth, another new SOP that's come out is about waiting for a 6-month period after your COVID positive case. Is that again scientific and supported by data and studies abroad? Because antibodies, we were last told, are present in your body till up to about 2 to 3 months after you've turned negative. Now we're talking about a 6-month window. Is that also scientifically proven?
So now let me just say that the single-dose strategy is the right strategy to go totally support the government, even if it made the decision now and not earlier. Now, going on the similar aspects, we must understand that more data has come forth about reinfection with COVID virus. And by the way, the antibodies do not correlate with the level of protection. That's well understood. And that is why we discourage measurement of antibodies apart from epidemiological surveys, but not for personal protection, because there are T cells and B cells which take part in the personal protection. What has been clearly seen and come out more forth is that you rarely get an infection up to 6 months, a reinfection up to 6 months after a COVID.